I know you've seen this, but listen to the detail of the benefits that he says are available. And there's been an update on this, so I want you to listen real quick.
Hi folks, Joe Namath here with a new message about your Medicare benefits. You may be entitled to transportation, meals, and expanded coverage for dental work that includes extractions, fillings, and dentures, all at no additional cost. Plus, depending on your zip code, you may be entitled to the Medicare benefit that adds money to your Social Security check every single month. Call and get everything you deserve.
So there's been an update on this, as I predicted 2 weeks ago, that CMS was looking into it. So I want to read to you the memo that just came out. So this is a memo from CMS, Kathryn Coleman, the director. Subject is third-party marketing, which is what that is. That's an organization that sells leads to other call centers, by the way. So it's not a specific agency. They just sell leads to a bunch of different places. I'm going to read the highlighted portion of this. CMS reminds all Medicare Advantage organizations that under 42 CFR blah, 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 they are responsible for first tier, that's themselves, downstream, downline agents, or related entities, which is what this is, adherence to all terms and conditions of the organization's contract with CMS, including compliance with all Medicare laws and regulations when acting on the plan's behalf. This includes, but is not limited to, the requirements that all marketing materials for Medicare Advantage be submitted prior to use to CMS, pursuant to 42 CFR blah, 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 and that all Medicare Advantage plans may not mislead, confuse, or provide materially inaccurate information to current or potential enrollees. Advertisements intended to draw a beneficiary's attention to an MA plan or plans and include or address content regarding plan premiums, cost sharing, or benefit information, including those not mentioning a specific plan by name, as well as instances where such advertisements are made on behalf of multiple MA organizations, are marketing, defined as 42 CFR whatever. Thus, these advertisements and marketing materials must be submitted to CMS prior to their use. CMS would not approve that. That's why I didn't have a CMS number on it. So it's about to get scary for those people. CMS is particularly concerned with national advertisements promoting Medicare Advantage plan benefits and cost savings, which are only available in limited service areas or for limited groups of enrollees, as well as using words and imagery, the Medicare card on there the whole time, that may confuse beneficiaries or cause them to believe the advertisement is coming directly from the government. In addition, CMS receives complaints from beneficiaries and caregivers that highlight sales tactics designed to rush or push beneficiaries into enrolling in a plan. Call now. MA organizations are accountable and responsible for their marketing materials and activities, including marketing completed on a plan's behalf by an FDR. An FDR is either first, downstream, or related entity. Where such marketing materials and activities fail to meet our requirements, the MA plan may be subject to compliance or enforcement actions. And then it says best practices to use. And it lists about 10 of them here, but one of them is requiring downline entities and related organizations to identify the origin of the enrollment lead. For example, a call-in based on the TV ad, which TV ad, response to mailing, etc. So they're telling these organizations they want to know where these leads are coming from. At the very bottom, this is my favorite part. CMS is monitoring the chain of enrollment, which includes the marketing materials, lead generating activities, sales talks, and enrollment process to ensure that activities are completed in accordance with all applicable requirements. We are also working with other federal agencies regarding the appropriateness of the content and of certain advertisements. That would be the Federal Trade Commission. So I think these BS commercials might get interrupted mid-AEP. I can only hope. But they sure are causing lots of confusion and turmoil for the legitimate people out there in the market. The good news is they're finally catching on. This is our crew right here that helps us administer helping seniors across the country. You will talk to one of these friendly people if you call into my office. We can do life insurance. We can do Medicare supplement and Medicare Advantage, Part D drug plans, do long-term care. Pretty much anything that has to do with retirement, we can help you with that. But we're going to do it from a position of first listening to you and seeing what you need, and then prescribing a recommendation based on experience and other people's past experiences. So thanks for watching today, y'all. God bless you, and I hope you have a wonderful day wherever you are.